Dear students, welcome to our learning community. We share medical education and MCQ practice to help you succeed in international exams. Each video is designed to build understanding, inspire success, and make learning enjoyable. Together, we grow and create a brighter future. Today, we're exploring one of the most important systems in the human body, the muscular system. In this lecture, we will build our understanding of muscles step by step. We will begin with the basic structure of skeletal muscle, then look at the three major types of muscle tissue, the connective tissue coverings, and different ways muscles are classified. By the end of this lecture, you should be able to identify the major anatomical components of muscle and understand how muscles are classified according to their shape, fascicle arrangement, number of heads and bellies, function, and joint action. General structure of skeletal muscle. Let's begin with the basic anatomy of a skeletal muscle. A typical skeletal muscle is attached to a bone through a tendon. The main fleshy portion of the muscle is called the muscle belly. If we magnify the muscle, we can see that it is organized into bundles called fascicles. Each fascicle contains many individual muscle fibers, which are the muscle cells. Inside each muscle fiber are numerous myofibrils, and myofibrils are made up of repeating functional units called sarcomeres. The sarcomere is the basic contractile unit of skeletal muscle. It is responsible for the shortening of the muscle during contraction. So, remember this hierarchy. Muscle fascicle muscle fiber, myofibril sarcomere. This is a very important sequence for anatomy examinations. Types of muscle tissue. There are three major types of muscle tissue in the human body: skeletal muscle, cardiac muscle, and smooth muscle. First, skeletal muscle is striated, usually has multiple peripheral nuclei, and is under voluntary control. It is primarily attached to bones and is responsible for body movement and maintenance of posture. Second, cardiac muscle is found in the heart. It is also striated, but unlike skeletal muscle, it is involuntary. Cardiac muscle cells are branched and usually have one or two centrally located nuclei. Third, smooth muscle is found mainly in the walls of hollow organs and blood vessels. It does not have visible striations, has spindle-shaped cells, and is under involuntary control. A simple way to remember the major differences is skeletal, striated and voluntary; cardiac, striated and involuntary; smooth, non-striated and involuntary. Connective tissue coverings of skeletal muscle. Now let's look at the connective tissue organization of skeletal muscle. The entire muscle is surrounded by a connective tissue layer called the epimysium. Each fascicle is surrounded by the perimysium, and each individual muscle fiber is surrounded by the endomysium. Therefore, epimysium, entire muscle; perimysium, fascicle; endomysium, individual muscle fiber. These connective tissue layers provide structural support and help transmit the force generated by muscle contraction toward the tendon and ultimately to the bone. At the end of the muscle, connective tissue continues into the tendon, which attaches the muscle to bone. Fascicle arrangement and muscle architecture. Muscles can also be classified according to the arrangement of their muscle fascicles. The first major pattern is parallel arrangement. The fascicles run approximately parallel to the long axis of the muscle. In unipennate muscles, the muscle fibers attach to one side of a tendon. In bipennate muscles, fibers attach to both sides of central tendon, giving the muscle a feather-like appearance. In multipennate muscles, several pennate sections are arranged together. The diagram also illustrates circumpennate architecture, in which fascicles are arranged around a central tendon. This architecture is clinically and functionally important because the arrangement of muscle fibers influences the amount of force a muscle can produce and the range through which it can move. Classification according to shape. Muscles can also be classified according to their overall shape. A fusiform muscle is spindle-shaped, with a thicker middle and narrower ends. A parallel or strap muscle has relatively uniform width, with fibers running mainly parallel to its long axis. A convergent muscle has a broad origin, with fibers converging toward a narrower insertion. A triangular or fan-shaped muscle is another way of describing this broad to narrow arrangement. A circular muscle, also called a sphincter muscle, forms a ring around an opening. Contraction of the muscle can narrow or close that opening. Finally, a quadrate muscle has a relatively square or rectangular shape. Knowing the shape of a muscle can often help us understand its function and identify it during anatomical examination. Classification according to number of heads and bellies. Muscles may also be classified according to the number of heads. For example, biceps means a muscle with 2 heads. Triceps means a muscle with 3 heads. And quadriceps indicates 4 heads. Muscles can also be classified according to the number of muscle bellies. A digastric muscle has 2 muscle bellies connected by an intermediate tendon. A polygastric muscle has multiple muscle bellies. These terms are useful because they provide information about the anatomical organization of a muscle directly from its name. Classification according to function. Now let's move from structure to function. When muscles work together to produce movement, different muscles may have different roles. The agonist or prime mover is the main muscle responsible for producing a particular movement. The antagonist performs the opposite action and can help control or reverse the movement. A synergist assists the agonist in producing the desired movement. A fixator stabilizes a particular part of the body so that the desired movement can occur efficiently. And a neutralizer helps eliminate an unwanted component of a muscle's action. For example, when we perform a movement at a joint, the prime mover may generate the main movement, while synergists assist, and stabilizing muscles prevent unwanted movements. This coordinated activity allows movements to be smooth and controlled. Classification according to joint action. Muscles can also be classified according to the movement they produce at a joint. A flexor decreases the angle between 2 bones. An extensor increases the angle between 2 bones. An abductor moves a body part away from the midline. An adductor moves it toward the midline. A medial rotator rotates a structure toward the midline, while a lateral rotator rotates it away from the midline. In the forearm, pronation turns a palm downward or posteriorly in the anatomical context, while supination turns a palm upward or anteriorly in the anatomical position. These terms are fundamental for describing movement in anatomy and clinical examination. How muscles are named. Muscles are not named randomly. Their names often provide useful anatomical information. A muscle may be named according to its location. It may be named according to its shape, such as deltoid. It may be named according to its size, such as maximus, which means largest, or minimus, meaning smallest. The name may describe the direction of its fibers, such as rectus or oblique. The name may indicate the number of heads, as in biceps or triceps. It may also describe its attachments, such as the sternocleidomastoid muscle. And finally, the name may describe its action, such as the depressor muscles. Therefore, learning the meaning of anatomical muscle names can make muscle identification much easier. Important muscle terminology. Let's review some important terms. The origin is generally the attachment that is relatively more fixed during a particular movement. The insertion is generally the attachment that moves more during that movement. However, these terms are functional rather than absolute, because the roles can reverse depending on the movement. A tendon is a strong cord-like connective tissue structure that attaches muscle to bone. An aponeurosis is a broad, flat sheet of connective tissue that serves a similar attachment function. The muscle belly is the fleshy, contractile portion of the muscle. A fascicle is a bundle of muscle fibers. A raphe is a fiber seam where structures or muscles may meet. And a retinaculum is a thickened band of fascia that holds tendons in position, particularly around joints. Understanding these terms provides a vocabulary needed to describe muscle anatomy accurately. Clinical correlations. Finally, let's connect muscle anatomy with clinical medicine. A muscle strain occurs when muscle fibers are overstretched or torn, often because of excessive force or sudden movement. A tendon injury can impair the transmission of muscle force to bone and therefore affect movement. Muscle atrophy refers to a reduction in muscle size. It can occur with disuse, denervation, or certain diseases. In contrast, muscle hypertrophy refers to an increase in muscle size, commonly associated with increased workload and resistance exercise. Compartment syndrome occurs when pressure rises within a closed facial compartment. Increased pressure can compromise blood flow and damage muscles and nerves. Finally, muscle paralysis can result from disorders affecting the motor neuron, peripheral nerve, neuromuscular junction, or muscle itself. Therefore, understanding normal muscle anatomy is essential for understanding many clinical conditions. Thank you so much for watching. If you found this lecture helpful, please like the video, subscribe to the channel, and hit the notification bell so you won't miss any future lessons. Keep learning, stay curious, and I'll see you in the next session.